We are discussing about median nerve palsy. Next we will discuss about the levels of median nerve palsy. So the median nerve can get injured either in the arm or in the proximal forearm, which is known as a high median nerve palsy. So if the injury occurs in the distal part of the forearm or the wrist, it is known as low median nerve palsy. So the causes are different. In the arm, the injury is rare. The cause can be a gut injury. At the elbow, cause can be either a supracondylar fracture of humerus or dislocation of elbow. And the forearm, the cause can be due to a cut injury. At the wrist, it can be due to a cut injury with a glass piece or a knife. And in the carpal tunnel, the carpal tunnel can be due to compression neuropathy, which is known as due to compression, which is called carpal tunnel syndrome. Now, what happens in a high median nerve palsy? Here, all the muscles are affected. All the vessels are affected here. That is the flexor digitorum superficialis, the flexor digitorum profundus, lateral half, flexor pollicis longus, pronator quadratus muscle, pronator teres, palmaris longus, another muscle is flexor carpi radialis, and thenar muscles like abductor pollicis brevis, flexor pollicis brevis, and opponent's pollicis, and first and second lumbricals. And sensory supply. So, due to loss of nerve supply to the flexor digitorum superficialis and the lateral half of flexor digitorum profundus, there will be pointing index finger when we are doing an Oschner's clasp test. Oschner's clasp test shows a pointing index finger. And there will be benediction's hand. Due to paralysis of this muscle. And as this muscle is affected, that is flexor pollicis longus is affected, we will not be able to flex thumb at distal phalangeal joint. Yeah, pronation of forearm is affected. And because of loss of nerve supply to the abductor pollicis brevis, abduction of the thumb is affected. So, pen test is positive. That is, while doing the pen test, the patient is not able to touch the pen by abducting the thumb at right angles to the palm. While doing pen test, patient is not able to touch the pen and when the nerve supply to the opponent's pollicis is severe, we will not be able to make an OK sign with the thumb and index finger. As the sensory supply to the lateral 2/3 of palm is gone and sensory supply to the lateral 3.5 fingers up to distal phalanx and distal phalanx of lateral 3.5 fingers on dorsal side affected. And there will be an 8th thumb deformity also and atrophy of thenar muscles. In a low median nerve palsy, Median nerve is injured at the wrist. So the median nerve is injured at a point where it has already given off the branches to the flexor digitorum superficialis, flexor digitorum profundus, lateral half, and flexor pollicis longus. So nerve supply to flexor digitorum superficialis, flexor digitorum profundus, and flexor pollicis longus are intact. So we will not get a pointing index finger. There is no benediction's hand. So these two tests are not positive in low median nerve palsy. All other muscles are affected as in high median nerve palsy. So the difference between the low median nerve palsy and the high median nerve palsy is that the pointing index finger and benediction's hand will not be there in low median nerve palsy, as the nerves supplied to the flexor digitorum superficialis, the lateral half of flexor digitorum profundus, and flexor pollicis longus are intact in low median nerve palsy. That's all about median nerve palsy. To see more videos from my channel, please subscribe our channel. Thank you.